Competency 4.3 elicit, document and present a correct history, demonstrate and describe the clinical features, choose the correct investigations and describe the principles of management of ASOM. ASOM stands for acute suppurative otitis media. It is an acute inflammatory disorder of the middle ear cleft due to bacterial infection. It is characterized by pus in the middle ear with accompanying discharge if the drum perforates. The patient presents with the following symptoms: fullness or heaviness in the ear, severe ear pain at night, deafness, difficulty in sleeping, fluid draining from ears, fever especially in infants and younger children, loss of balance. Demonstration of clinical features. It is by otoscope. In the otoscope, the following can be appreciated, like redness, swelling, blood, pus, air bubbles, fluid in the middle ear, and perforation of the eardrum. Tympanometry. It is a small instrument to measure the air pressure and determine if the eardrum is ruptured. Reflectometry. It can determine if there is fluid in the ear by listening to the sound reflected back from the ear. And hearing tests like Rene test and Weber's test. Clinical features. There are 4 stages in ASOM. The first stage is stage of hyperemia. The symptoms are fever, ear pain or fullness with or without hearing loss. The signs are retracted or congested tympanic membrane with leash of blood vessels along HOM and at the periphery, like cartwheel appearance. Second stage is stage of exudation. The symptoms are marked earache, throbbing with disturbed sleep, hearing loss, high-grade fever in infants. The signs are tympanic membrane is thickened, conductive hearing loss. In infants, tenderness and edema over mastoid cortex. Radiologically diffusely clouded hair cells but without alterations of cell partitions. Third stage is stage of suppuration. The symptoms are excruciating pain, deafness increases, fever, toxicity increases. The signs are tympanic membrane is red and bulging to the point of rupture. Mastoid tenderness is present. The fourth stage is stage of resolution. The symptoms are earache relieved, fever subsides, ear discharge starts. The signs are discharge in EAC, external auditory canal, mucopurulent or blood stained, and perforation of pars tensa. The investigations are hearing tests, blood glucose, diabetes mellitus, Putone audiometry, unilateral, SN hearing lost in neoplasm of ear, malignant OE, to rule out CSF leak, transferrin in discharge fluid, culture and sensitivity for refractory cases in which initial antibiotic therapy has failed, CT of temporal bone, fracture and osteomyelitis, biopsy when auditory canal granulation tissue is present. The treatment is antibacterial therapy. In antibacterial therapy, ampicillin 50 mg per kg per day in 4 divided doses. Amoxicillin 40 mg per kg per day in 3 divided doses. Decongestant nasal drops can be used. Ephedrine 1% in adults and 0.5% in children. Oxymetazoline, xylometazoline. Oral nasal decongestants like pseudoephedrine 30 mg twice daily. Analgesics and antipyretics, paracetamol. Ear toilet, dry mopping. Dry local heat relieves pain. Myringotomy, drum is bulging. Incomplete resolution despite antibiotics, persistent conductive deafness, persistent effusion beyond 12 weeks. Thank you.